is to give you a little updates in modern periodontics and advanced healing strategies that you can actually bring into your own life. I work with a lot of holistic patients, and I find that you've seen people with lines and all different types of conditions, and so like what's going on in people's bodies. So I try to really look at, hey, how am I going to get people to heal? So I'm so privileged to get to work with Ziv and Ari in Beverly Hills and at Periodontal Implant Specialists. I'm so blessed. And so we're looking at health and healing. So what is my health journey? I look at myself as someone who has learned how to work with my own body. I think we all go through life, and when we're in our 20s, we're unstoppable. We don't realize, hey, what's happening to our bodies. And so for myself, I mean, I want to be able to go up to 13,000 feet and hike up a mountain and be able to do some extreme skiing, go helicopter skiing. So I look at, I want to go travel, do dental missions. One of the one on the left is me in India, and just the people are lining up in these little villages, and it just gives you a lot to be able to help people. And in order to do these things, you need to definitely keep your body in good shape. And I love going down to Argentina and taking my tango lessons down there, and even learning new sports. I mean, this is me picking up surfing not long ago, and love jumping horses. These are my babies, so that's my favorite. It's being able to go hike with these guys. So that's why I live the way I live, keeping myself healthy. My dad just turned 90 April 1st. It was, kind of the humor of my dad. My dad has a great sense of humor, so being born on April 1st was perfect. But actually, he did go through a serious health challenge recently. He had a lymphoma that was related to Roundup, and he used to spray at our place in Vermont. He used to spray the Roundup to kill the weeds, and nobody ever really made an issue of that can give you lymphoma. And it's a type of lymphoma that's very rare, other than if you're using that type of stuff. So thank God, knock on wood, he's doing well, and he went through chemo, but that was hard to see. So talking about stuff in our office, this is in Beverly Hills, and so it's important to be able to tell your patients how to take care of themselves post-operatively. When I was living in Colorado, before I moved to LA, I had a friend who had gotten into the holistic dental world, and he was doing Ziv's course online, so he'd always be talking about Ziv. And so I go to the Beverly Hills Academy dentistry meeting, and I saw Ziv. I'm like, okay, I've seen him on these videos that my friend just kept on showing me. And so we had dinner together, and who would have thought, a few years later, we'd be working together. And this was the interview process. So he gives a vigorous interview. Once I was able to do the Calabasas stairs I think we did it about 5-6 times. That was a pretty funny interview. So we actually live close to each other, so we drive together, and so I'm always in his ear talking about all the biohacking stuff all the time, and so he calls me the biohacker periodontist, so he's given me that title. And we're not talking about this type of hacker that's malicious. Hacking biology. So, what is, first of all, a biohacker? We're using scientific, proven data and technology methods to optimize our body, mind, to improve our health and performance, right? So there's things to look at, how are you able to heal? So first of all, there's the natural healing ability, an amazing part of our body that just knows what to do. It knows to go seal up an area and bring the right cells over, and you look at what else needs to happen. You need to have the necessary components in your body, so supportive practice, they need maybe painkillers, maybe antibiotics, maybe some other stuff, and also I think mind-body connection is probably a little bit understated in our profession. Sometimes we're like, okay, we're, just telling the patient, hey, this is what you do post-operatively, but, I think our thought process a lot of times will help us to heal. When we think, oh yeah, they took good care of me, I'm gonna heal well, these things help our body calm down, so our cortisol levels are lower. I know when I've gone through stressful times in my life and my cortisol levels are up, first of all, I get a sore back right down here, so what's down there? Your adrenal glands. So you gotta really understand, hey, back pain's not always about that your muscles are sore. Sometimes you're just under stress and your cortisol levels are out of whack and you're stressing your adrenals. So the way we think, sometimes you can make yourself crazy and it'll just put you in the spiral, downwards. So periodontics is, it's changed a lot. We now, the old way we can do, a lot more receptive and removal, and now we're able to do some regenerative technology, lasers. We can test for DNA so that we can see what we're dealing with, how we best treat it. There's ozone treatments. A lot of people really haven't incorporated that into their practices yet, but I think that's on the horizon. And PRF, using your own blood to heal your body, and doing conservative procedures where you're not like cutting a big flap open, and so your blood supply is not compromised, and the tunneling really can work well. And then, just accelerated healing methods. So again, this is what I get in the car, and I'm a biohacker periodontist. So what can we do? So we can sample the bacterial DNA, looking at these gums, like how do we go about healing it? Do we need to add in antibiotics into the treatment? And so the DNA testing can help us to know that. And so this is a sample of a DNA test and seeing what type of bacterium. They give us suggestions, so it really helps out. Not only does it help out for us planning the case, but also it helps us educate the patient so they understand. Because if they don't take on the problem as theirs and they're just like, fix me, doc, that's taking part of they're not taking responsibility. I think that's important for them to take responsibility for their disease. So, just showing the different pathogens. And so how do we, let's say, HPV, it's one of those subtle types of things that it can go undiagnosed, and these subtle lesions, they just look like, so if you don't look carefully, you might miss them. So why do we care? Because 60 to 70% of the throat cancers, which are mostly subtype 16, they cause, a big problem. And so, if you've heard of Michael Douglas, his whole situation, and so it can happen to anybody that has this infection. And that's just, showing something in the back of the throat, so you can miss that easily if you don't really take a look. So. And there's, DNA testing that you can test to find out what's going on, which type it is. And so I think that's real. You're doing a great service for a patient, because you might be saving their life or preventing a cancer in the future. So at our office, we've taken on a protocol now, so we do excision of the area, and also in order, because the virus gets into the tissue, it embeds itself. The laser is a great aid to help to reduce the viral load. So I think this is necessary these days for any type of treatment like that. So how do we biohack perio defects? So, if you take a look at this defect, you'd be like, oh, maybe that tooth needs to come out of there. And, you look at this, really badly broken down. And so this is looking at it opened up, cleaned out. It's pretty deep, but you know, we have great ways to treat it now. We'll put some Endogain there. You know, it's cleaned out real well, and pack some bone, put a membrane, and close it up. So, you know, we can get some great results and save some teeth, because no matter what, I think if you can keep a natural tooth, it's always the best way to go. You know, implants are great, but they still have their problems. Periodontitis is one of the most prevalent things these days that we see. Light is very, you know, it's amazing that we now have this technology that we can disinfect with something so powerful, or a little unit that can throw out amazing wavelengths of light. So this is, we actually have the Photona laser in our office, and this is us at our training, having a little fun there. And so there's all different types of lasers out there. So, you know, the Photona has both the ND-YAG and erbium. There's CO2. Really, CO2 is not that prevalent in dentistry. Diode, a lot of hygienists use the diode laser for bacterial reduction, and the periolaser. So, you know, if you're familiar with the Lynette procedure, and so that the good thing about the Photona is it has both the ND-YAG, so you can do the different types of procedures, and then the erbium, and depending on what you're doing. If you're doing some, let's say, like I used to be a general dentist for a long time, and one of my favorite things for the erbium laser was veneer removal. You just put it along the veneer, and oh my God, it comes off. It's like, you know, that was the hardest thing to do. So there's so many ways to use these lasers, and it just depends on, you know, there's different price ranges. And so what's the difference between the lasers? It's basically the wavelength. So, you know, we're just working with light. So how do they work? You know, it's a focused beam of light. It's the energy sent to the tissue, and depending on what we're performing, we'll use a different type of laser light. And so we can be cutting, reshaping, cleaning, you know, removing calculus. And if you're doing some restorative, you can, as I said, remove crowns, veneers, and it definitely helps speed up healing and helps with regeneration. I mean, today I was this one implant that I had done an immediate implant on. I deal with a lot of holistic patients, so they wanted their own bone, and working with your own bone is not always the easiest, especially doing an immediate implant. And I ended up treating it with the Photona, and surprisingly, it was like 8 millimeter defects around it, and they've actually closed up. And so it's amazing what it can do. So the Photona, as I said, it has the two lasers in one, which is really nice. And so that they have the twin light protocol. You know, every laser has its advantages, disadvantages, and you're going to be spending, you know, for something like a Photona, you can be having a really nice sports car if you want, but instead you just have this big thing in your office sitting there. Hopefully it's not a door stopper. And so that's a very expensive door stopper. So, you know, this patient I saw, and they were having this red area around this crown, and we couldn't figure out what was going on. The dentist, you know, wanted to fix that and didn't understand why this is happening. The margins were fine. There was no cement under there, and no resolution for months. So after treatment with the laser, you can see how much it improved the look at the gum line. So it's amazing what, you know, a little bit of light can do, even treating periimplantitis. So it's just a great modality. And then there's also, how many people know much about red light therapy? Anybody here? Yeah. I mean, they use it a lot in the beauty industry. I mean, a lot of people for even hair stimulation and all that. So PBM we use for post-operative care to help people heal faster, and so what it does is it affects the mitochondria. It upregulates the mechanism in the mitochondria. So this is one of the attachments that we use, and we can put it extraorally, intraorally, and it definitely, patients notice a difference, and it really helps to reduce discomfort and swelling and all that. So, and this is actually, if you want to go, really do a big, red light treatment, this is like the old tanning beds. They have this. I go once in a while. It's amazing. You just feel energized after. Additionally, we can use our blood platelets to help us heal, right? So how do we tap into the potential of platelets? So we can take our sample of blood and spin it in the centrifuge and take the growth factors from it. And so we use that regularly in the office, and it really, it's such a nice modality. And you can see that here the top layer is the plasma, and then you have the clot, coming right over here. And this is the part that we're using. This is, this is the area where there's the biggest concentration of factors that are going to help with healing. So this is showing our assistant spinning the blood in the centrifuge, and that's how it comes out once we take it out. And here's a tray setup. You can see how it forms these nice little membranes, and so it's very easy to use. And so that shows the size of these membranes. And the amazing part is I don't know how many of you have done bone grafting or do bone grafting. I remember when I was when I was going to school, we didn't use PRF, and you'd have all those granules everywhere, and then, to get it to stay, it was such a hassle. Unless it's a contained socket, but even that, get stuff spitting out. But once you make the sticky bone, oh my God, it just makes life so much easier. And additionally, we will add some metronidazole to the bone graft material so that it helps to decrease the chance of getting an infection after. So you can see the way the sticky bone, you can pick it up with cotton pliers, and so it's all stuck together nicely. And so here's some membranes that are formed. So we squish them, and they can cover a healing site and help in healing. And so, we can use it for bone grafting, we can use it for soft tissue procedures, and so sinus procedures, and so we use it all the time. It's one of our most used procedures, PRF. And so here, just showing an example of what it looks like doing it. We're putting these are so amazing. This is like your biology helping you heal. So those are the membranes, and suture it up over it, and it heals, within 1 or 2 weeks, it's all healed. And then you can put it in, for tunneling procedures, and so it really helps with everything. So what does it do? It stimulates tissue regeneration, enhances wound healing, reduces inflammation, and then helps with bone regeneration. And additionally, infections are definitely decreased. So what other types of biohacks can we do? We can biohack oxygen. So how many of you have done any yoga or do yoga or have done any breath exercises? Anybody in the room familiar with it? Yeah. So how many people here, what I want you to do is just try, is there anybody that knows they can't breathe through their nose? So what I ask you to do is just if you don't mind putting your finger on your nose and try to breathe in through your nostril and see, can you get like a full breath of air? And then close the other side and then breathe in and see, can you, first of all, breathe through both sides. So an amazing thing that I discovered, because in yoga they talk about that our body knows how to use both sides of the brain, and it switches like between this nostril and this nostril every 2 hours. So I never really understood it. And one time I had a cold, and when I lived in the mountains of Colorado, you would get a sinus infection a lot of times because the altitude would affect you. So this time I had a cold, and I was determined not to get a sinus infection because I didn't want to take antibiotics and all that. So I started doing alternate nasal breathing, where I go, hold it, breathe through that. And what I noticed was one nostril would be clogged, and then 2 hours later, the other nostril would be clogged. So it showed you, or showed me, I should say, how the body, and just like I'm talking about, your body has a natural knowingness of healing. It actually does know how to switch, and that affects both sides of the brain. So when you're actually doing like an exercise of alternate nasal breathing, it's called, you're closing one nostril, breathing in, holding it, and then breathing out through that other nostril, and then you do that. That actually is very good for your mental health because it balances both sides of the brain. So just another little hack that I always give them a little pearl. I don't know if I've told you that one before, but or you've heard that before. But so what does nasal breathing do? It actually helps to stimulate the vagus nerve, which is something that I had a friend of mine that she was doing a yoga teacher's training, and it was years after I finished school, and she says, "What's the vagus nerve?" So I'm like, "Okay, I totally forget, and why are you asking this?" And she says, because in her yoga teacher's training they were talking about that they use the nasal breathing is used in order to calm the whole system and stimulate the vagus nerve. So it was amazing that I got that little information. And the even more amazing part was on my way home that night, somebody almost hit my car. They almost went into my lane, and you know how that, like you feel that like rush of adrenal energy going into your body? I was like, oh my God, this is when I could use that nasal breathing. And so I ended up just going into my body, started breathing through my nose, and it was amazing. So, if you get into a stressful situation at some point, remember that, and then start nasal breathing, and you'll see how it just calms your whole system down. So another biohack for tonight. So hopefully you'll be able to use it. Hopefully you don't have to use it when you leave here, but LA, you never know. So has anybody here heard of Wim Hof? So Wim Hof is a expert at breathing. I mean, that's what he does. He travels around the world and teaches people how to breathe, which, how nice is that in a way, especially when you're sitting over patients all day and then you hear they're complaining about stuff. I'd rather do this. This is quite a little more relaxing. So he can actually he teaches people how to breathe and then go into cold plunges, and they measure his temperature on his body, and he doesn't get cold by doing these breathing exercises, which is quite amazing. If you look back at the Buddhist monks and stuff, they can actually sit in, they have breathing practices that they've done over the thousands of years where they can sit in not a puddle of snow, but it becomes a puddle of water after they've been sitting in it doing breathing exercises. So what is it doing? It's helping relax the whole body with the parasympathetic, and so it's bringing your stress levels down. So what I'd like to do right now is just get everybody to practice this with me, because I think this is really good, because I think that until you practice something, you're like, oh, what the hell is he talking about? That's, oh, okay, that's nice. So can I have everybody's participation here?
Sure.
Yeah? Okay, great. So I'll explain it to you what the formula is. So it's basically 30 to 40 breaths. So you want to go breathe in through your nose and then out through your mouth. So you're doing that for 30 to 40 times. I'm not going to, hold you to, if you do 25, whatever, it's not a big deal. So on the last of that series, the exhale, I want you to hold your breath out. So like, so on the out breath, you hold it as long as you can, and then once you can't hold it anymore, take a deep breath in and hold that at the top. And so we'll do 3 rounds of that. If anybody, actually, does anybody have any serious heart condition or anything? Because that could be a contraindication. So, okay. So if you do have like any serious heart condition, it can raise your blood pressure a little bit. But I think it's an amazing amazing thing to do. I do this every morning actually before I'll put my feet on the ground, touching earth, and I'll do this. So let's start. Okay. Okay, that's about 30. So exhale. Hold it as long as you can. Inhale whenever you're ready. Hold that as long as you can. And then just breathe normally. Okay, let's do one more here. In the sake of time, let's just hold your breath out. Breathe in whenever you're ready. Hold that at the top. And let it go whenever you're ready. Actually, how does everybody feel here? Do you notice a little difference in your whole mood, state of mind? A little more awake? Almost like you had 2 espressos or something? So, this is something that's available anytime, and so definitely use it. Let's say you're feeling tired or something and you have something to do. How else can we biohack oxygen? So again, ozone, which is O3, we use that regularly in the office to disinfect stuff. So this is the ozone machine, and it's the generator. And so we'll use it in 2 ways. We can use gas, or we can use ozonated water. So when we do an extraction, let's say we'll take some of the ozonated water, run it through the extraction socket, even post-operatively if a wound needs a little care, just put a little ozone on there and that'll help to clean it up. So what does it do? It kills bacteria, viruses, fungi, and also helps stimulate your body's natural healing process. So, some of the benefits here. So clinical use, we disinfect extraction sockets, helps stimulate bone growth, and enhances healing. So it helps with blood vessel growth. So here's, socket affected, clean out the socket with curettes, ozone, bone graft it, put our PRF plug, and look how beautifully that heals. And we're using the body to create that. And so other treatments, you can actually get ozone injected into your blood. There's different procedures. There's some, I deal with a lot of, cancer survivors and people dealing with Lyme's. And so you can go to a clinic where you can do a 10-pass where they take out your blood, ozonate it, and it actually does help people for a while to feel better because it kills all those pathogens in the blood. So biohacking implants. So in my world, I do a lot of zirconia implants, and I know that it's been looked upon as, do they work and all this stuff, do they last? Yes, we don't have the long-term data, but I think the tissue heals really nicely around them, and if you know what you're doing and you know how to place them, it can work really well. And the thing is the holistic patients are great patients, and some of them, there's three types. There's the health person that's just looking for health and they want to stay healthy, and there's the ill person that's looking to try and get better. And then there's a little bit of woo-woo, that they're a little mishiga. But, you got to deal with everything. So, here's an example of implant placement, and look how nicely it works out. And so I do a lot of the SDS implants. This implant is very good for immediate implants. And one of the keys, with this implant, it's actually preppable, and so you need to keep enough implant above the gum so that you can get a nice ferrule effect. And so I think that's one of the key things. When I was first starting to use them, I didn't realize how important that was as much. And I did have one or two break off because of we were relying on the abutment to hold the crown, and you do not want to do that because that's going to break. That's going to cause failure. And so here's some examples of some immediates. And so zirconia, the advantage is when you have thin bone biotype, you don't have that metal show through. The problem is you don't have a lot of angulation change, but these are preppable, so they're like natural tooth, so you can make some changes. You don't want to over torque them, that's for sure. And patients, that don't want metal, they do ask for this. So, titanium definitely is a little bit better for like an all-on-4 full mouth type of procedure. A little easier to make angulation changes, and you can have higher torques with them. So how do we biohack the immune system? Has anybody here had a vitamin IV drip, like a Myers cocktail or anything? No, nobody knows about that. Wow. And do a lot of people? How many people take vitamins here? Yeah. So the Myers cocktail, actually, I first found out about it when I was working with this naturopath, and I was feeling like I was getting run down, getting sick. And so he gave me a Myers cocktail, and the next day I felt like perfect. The Myers cocktail includes, a lot of different things. One of the main ingredients is vitamin C, and so definitely vitamin C has its things. It's a great antioxidant. It really helps you. But if you are getting a high dose vitamin C, one of the contraindications is if you have a G6PD deficiency. I'm telling you, there's IV clinics everywhere. You can find one on most blocks these days. And if you are feeling a little run down, or you're just not feeling yourself, maybe you travel or something, and you want to get back feeling good, I would highly recommend getting a Myers cocktail. It's really, the next day you'll be like, oh my God, I feel like 100% better. So one of the things I think that we really stress to our patients is vitamin D. I think a lot of our failures are because the patient's not aware of what their status is. So how many patients do you ever ask their vitamin D levels? Do people require that knowledge in their offices or even in the schools? What do they tell you about vitamin D? Anything? Yeah, so no, I'm just curious. I'm not in the school system right now, but so they're not really talking about that. So I mean, you think about, vitamin D is created in our skin from sun exposure, right? And maybe some of our foods. But what happens in our society, we're told, don't go out in the sun. Put sunscreen if you're going out in the sun. So the sun exposure is not giving us the vitamin D that it used to. So we're wearing a sun hat, we're wearing clothing that protects us. So really it's important these days to, first of all, have your vitamin D level tested, especially as we get older. I mean, that's, I think a big problem with osteoporosis and everything. So this is something you should always ask your doctor, hey, what's my, I need to get that test, and then supplement. One of the things, how many people know about K2? The system is, vitamin D3 helps to get the calcium into the blood, but what gets it out of the blood? What gets it into the bones? It's K2. So if you're not having enough K2 in your diet, let's say, because if you're not eating on the right foods and everything, you're actually getting maybe all this calcium into your blood, but it's not getting out into your bones and out of there. So you might get calcified arteries. So really K2 is an important thing. So I always take a supplement that has both D3 and K2 in it. And then, vitamin C is important for collagen. We went through the whole pandemic and everything. They did stress, how important zinc is, and that's an important component in healing. So, the only problem is sometimes we take this like plethora of pills and everything, and so what's really getting into our body? I had one patient that he owned a porta potty company, right? And so he would tell me about that there's a lot of expensive poop in his porta potties a lot of times. They're actually finding a lot of these pills that don't get digested. So one of my biggest advice to you is to actually make sure that your vitamin is going to dissolve, because if you're taking this, this pill that is like clumped together and it's kind of a chalky type of material, if it doesn't dissolve in a glass of water, maybe you put a little more acidity to that water, so it's more like the stomach acids. But if it doesn't break down within about 10 minutes in that glass, you're having, a very expensive bottle that you're buying that's not getting into your system. It's making the vitamin company wealthy, but you're not getting the nutrients you need. So do a little research. And actually, a patient of mine today just told me they were having mold toxicity found in their blood, and so they had it set up in their house. You get mold testing. Let's say you're buying a new house or whatever, you want to make sure that there's no mold. And so they ended up finding out that one of their vitamins actually had mold in it. So you have to go with a reputable company, and who knows, maybe even some of those, you could be getting some toxins in your vitamins. So be careful. So one of the biggest things, actually, this is something that I've been getting Ziv into, and what we just did in our office, well, him and I and Ari, we all just did our DNA testing. I just got my results yesterday, and so it's just a cheek swab. And what they do is they analyze certain genes of what your propensity to certain things like I always knew that lactose was not a great food for me, and it confirmed it on my test. And it also gives you suggestions of like, methylation. So in order to get your folate, your B12, your B6 to an active form, you need to methylate it. So it's really important to know I think these days, once with us knowing all this information, it's critical, and also it allows us to age better. Because if we can know our biology beforehand, like when we're in our 20s, then we can actually know what do we supplement with, what do we not waste our money on in supplements, because we're good with that. So it really helps you out. And one of the things, actually, all the young people in the room that are going through school right now, get your hormones tested at this time, because I think it's important to know your hormone levels in your 20s and stuff, because when you're older, they don't tell you this. No doctors really tell people, hey, know your hormones at your younger years, because then if you're going to get, let's say, supplementation or anything like that, you want to know what the level was when you were younger, so that you can know a proper level. Otherwise, they're just telling you, oh, okay, supplement like this, but you want to know your levels. So really do some research. And so this is a company that we're working with, and they do have a metabolic test and a GI test, so those help you to know some of your other factors and everything, and also make sure you get a thorough blood test, because you want to know, in conjunction with this, it'll help you know your body better. So especially when you're young, the genetic test you only have to do once in your life, because you're finding out what your strengths are and your weaknesses in your body. So going on to like healing. So biohacking, what's important. I mean, I had this patient a few weeks ago where I had done an extraction. 3 weeks later, it still hadn't closed up. And I mean, I usually see within 2 weeks, like it's usually healed, closed up. And I said, what's going on with you? What's like, how's your A1C? She said, oh yeah, it's 9, and I haven't done anything about it and all that. Then I said, how about your vitamin D levels? Oh, they always tell me they're low, they're like 15. So really what we're shooting for is, I would like to see my patients at about 50, for vitamin D reading. So just some numbers. The K2, I don't know if there's any tests out there yet for that, but the D3 is real important. So reduce your inflammation. Foods, our diet, the less processed the food, the better. One of the things that cholesterol, LDL, has been linked with poor healing. So do check, what's going on in your patient's body. We always advise, you don't want supplements that are going to be blood thinning. Ginger, garlic, green tea, ginkgo. Those are all things that preoperatively you'd want to stop a week before. Aspirin. Those are all things that are going to cause more bleeding during the surgery. So one of the things that I think a lot of docs are not stressing with patients is their gut, because a lot of times, in order to prevent a bone graft from getting an infection, we'll give them antibiotics. And does anybody know much about SIBO? Anybody? No, so SIBO is when the gut just gets out of kilter, and so these people, they have horrible gut problems after. So it's real important to support the gut. If you're giving antibiotics, like they should be taking prebiotics, they should be taking probiotics about an hour after, and so that helps to keep the balance in the, because you're killing all the good bacteria when you're putting them through a course of antibiotics, and that causes a problem in itself. Another thing that can help is, actually, when you think about it, you have in the Jewish holidays, you have a day where you have to fast, so how hard that is sometimes, because you've seen all the food around and you want to eat. But intermittent fasting, there's actually something really beneficial, because you're resting the whole body. You rest the digestive enzymes in your gut, your whole body can detox. So it's a really good thing to get into the habit of. And so what happens when your cells, when you're fasting, so your body cleanses itself, it improves the immune response. I mean, and if a patient, is doing a kind of fasting, you want them to still have some liquids and support. You don't want to just like no food at all, but some, really minimal types of stuff that they have to process, and boost the stem cells, your blood sugar levels. I mean, that's critical, I think, in healing. And so we're helping angiogenesis and less inflammation in the body, and then you feel better. So one of the things that I love is, not everybody would love this because if they're claustrophobic, but a hyperbaric oxygen chamber. So it's getting oxygen pumped in, and so for treatment for certain wounds that don't heal. That's what you do, and so I think it's great. So we're actually, it's pretty funny because even though you're going through traffic in LA and all that, Ziv and I, we're always talking in the car. So over a bunch of our car rides, we actually have, and also Ari, we came up, we're writing a book on the healing path. So it's for any type of profession, for preoperative and postoperative healing. So just tips and support. And so that's going to be coming out in the next few months. So we'll keep you posted. When let's say I'm traveling a lot, or I just got back, I'm tired, or feel like I'm getting run down, I'll schedule an appointment. I'll go do a hyperbaric oxygen. I'll do right after. I'll go into the red light for 30 minutes. So that's upregulating your mitochondria. So you just got all that, super oxygen into your body. You go into the red light. You're processing with your mitochondria, and then get a Myers cocktail. I mean, that's, if you want to feel good after, or if you want to feel good and you're not feeling so well, try that out one time and you'll be sold. So some of my little tips of, how if I'm traveling and I can't have access, a lot of times I'll travel with the Dr. Schultz. It's a little bit of a heavy thing because they're glass little bottles, but they have ginger, garlic, horseradish, like all these different things, and you can do those shots. And when you start feeling a little bit of, that cold feeling coming on, you do a few of those, and you're feeling good after. And so, another little tip is you can certain antivirals, or oil of oregano, garlic, ginger. Make some ginger tea and some honey, and so that will help you. So these are my little tips that hopefully you can take home and use, and hopefully you don't have to use it anytime soon. And then there's always the good old chicken soup, right? Yeah, exactly. So as we just experienced the breath work and grounding, that would be something that I haven't talked about yet in what it does for us. So there's actually studies that have looked under microscopes in looking at the way the blood cells are before and after grounding. So this is a way to biohack your blood, so you can see on these how they're all clumped together, and after the grounding they've taken on a charge so that they're repelling each other. So this is just a little video.
Blood before, this is 45 minutes later. All right, and you can just see what's happening. Look at it. See, there we have the agglutinated blood, the coagulated blood. There's the free-form electrostatically charged blood. Let's go to subject 3. You see the grounded blood again, 45 minutes later. Subject 4, look at that. We're electrical creatures way before we're chemical creatures.
So,
Electricity affects.
you know, just a little thing that it shows, you know, you when you think about it, when you go to the beach, how good do you feel after you've been walking on the sand barefoot, and even like the air around there is all charged particles and everything, and so there's science to this, and you know, we need to make sure that we get our shoes off. We're always walking around with shoes that are plastic or, you know, rubber or whatever, and we're driving cars and we get all like uncharged, and so remember to connect to the earth. And so this is an interesting way to look at mindset, because our thoughts create our reality. So what I can liken this to is, first of all, our bodies are 70 to 80% water, right? And so this Japanese scientist, Dr. Emoto, has anybody heard of this stuff? No, this research. So if you look, I don't know how well everybody can see. So this one is, so what he did was he exposed water to different energies, right? And then he froze the water and he looked at the patterns that were formed. And so, you know, this is the pattern when happiness was exposed to the water. This is, you know, water before and after a Buddhist monk gave a prayer. So you can see how it's like all intermeshed and ugly and stuff. And look at the beautiful pattern that it forms. And this is tap water before prayer in a primary school, and this is after the prayer. And so, you know, he just looked at different places like glacier and river. This was a pattern that was found after love and gratitude were expressed. So these are some other examples, you know, when the word angel, the word peace, and you can see, and look at this, it's you disgust me. Look at the way that pattern is. Or like when you put the energy of you fool on someone, you know, how does it feel when you're actually receiving that? So your words are powerful. So really, you know, the mind-body connection is not really, I don't think, fully understood to a lot of people, but you know, we're in a synagogue. It's a place where people pray and do, you know, hopefully good deeds and try and help people, and also beautiful prayers. And you do feel good after you leave a place of worship where you've had a beautiful choir, let's say, and they're singing. My dad, when he'd go, I said, why do you like going to synagogue and stuff? You know, he would always be like, I love our choir. And so that was the beauty of it, and he always felt uplifted. And so that, you know, there's some science behind. It's like when you go into a room and you're like, that person just drained my whole body of energy, and so you feel it. So, you know, there's something to be said about positive mindset. You bring it there with you. So always remember that in the back of your mind. And you're water, and so you're affecting other people's water. So, you know, this is kind of, we didn't actually say it this way, but take your meds. So mind meditation. Make sure you do exercise. It's important to get your blood flowing in your body. You know, if you're doing dentistry sitting all day, make sure you get up once in a while and maybe do some squats or something like that, or do some procedures standing up, just so you're not getting your blood, or even if you have a staircase in your office building, walk the staircase, don't take the elevator. You know, in this day and age, with all the pesticides and all the foods, really be careful. Use organic foods and know the source if you can. If you can go to the farmer's market, you know the farms. You know, there's so much toxicity that's going to help your body stay healthy. And of course, sleep. You know, it's You have this cell phone next to you, and it's always every, 3 seconds, it's always trying to connect with the towers and everything. So if you have that cell phone next to your bed and it's working, it's giving you radiation. So put it on airplane mode if you're ready to go to sleep. Don't look at that screen, or at least put it on a nightshade, for a few hours before you go to sleep. Or you can buy these glasses that are orange colored glasses that help you to block out light, because your brain starts knowing that it's nighttime. And if you're looking at too many bright lights and everything before you go to bed, don't stimulate yourself by looking at a bunch of stuff on the internet, like on Instagram or something, because a lot of times that's going to stay in your mind and you're going to stay awake at night. So even, read a book. Just do some relaxing practices. Have a relaxing tea that has some good chamomile or something like that. So just little tips, because I think if you don't get enough sleep, you're not having any time for your body to relax and detoxify. So again, we'll let you know when this book is coming out, and I really appreciate everybody. Sei gesund, be healthy, and thank you so much. I hope that this gave you a little bit of other stuff that you even expected, because I think I went a little more into a realm of our overall health, and I hope this, if there's one or two things you can take away from here and it changes your life, I feel honored. Thank you.